Good afternoon, everyone. This is Chris Linenberger with the Texas Homeless Network out of Austin, Texas, and you are tuned in for the May Bloc Talk session. This is our monthly hour-long webinar that we do at the end of each month to talk about best practices around the state of Texas and specifically around homeless issues. So in the past, those have focused around housing, education, other genres. Today, we have Elizabeth Lutz that's here with us to speak about collaborations and also working in the collaborative effort with unaccompanied youth. So we're going to get moving on with our webinar. You know, I like my memes, so I just want to talk about this one. Of course, you probably know of all the rain we've received here in Central Texas. I want to say that in the last 30 days, Lake Travis, which is our water source here in Austin, has gone up, I think, approximately around 20 to 30 feet, if not more. So we have received a bunch of rain, especially over the last weekend. Please keep those families in your thoughts that are in Wimberley, Texas. They received quite a bit of flooding, and many houses were lost, and still they are looking for individuals down there that are lost as well. So keep them in your thoughts and prayers, and we will keep asking for some rain because we definitely need it down here. Just slow and steady would be a lot more appreciated than all at one time. So I hope all the rest of you guys are doing well across the state, and that all of your water resources are being refilled this time of year as well. So for today, it's our usual housekeeping and announcements, followed by the unaccompanied youth with community health collaboration. And then we're going to, the most important part of this series that we do is really giving you guys some time to ask some questions and to get some real-time feedback from our professional that'll be on the line. And then I'll come back on around, at the whenever we get done with that, to close it out and follow things up. So please, as we are going through the presentation, please be thinking of questions and also take some time to write in your questions. Another reminder is that during the presentation, and right now your microphones are muted. That is due to the fact that if they were not muted, we would be getting a ton of feedback. And so when it comes time for you to ask your questions, please do as the window there in front of you is showing with that big arrow. Go to the questions tab on your toolbox and type in your question at that point. You can ask a question at any time, whether it's now or during the presentation or after or before the presentation. As soon as that question comes to your mind, type it in there so we have it to go. What we'll do is we will save all the questions till the question and answer time, and then we will systematically go through and answer as many of your questions as we can. Also, keep in mind that we are recording this webinar, and that is so that you will, or you can go back later and review the webinar, along with all of our other webinars that we've done for the last year. So feel free to go back and take a look or listen to what we've done in the past. As well as know that if you miss any in the future, we will be recording those as well. Again, this Bloc Talk is provided by the Texas Homeless Network. We focus on providing your community the opportunity to learn how to more effectively serve your homeless population. This is through effectively looking at and exploring successful practices around the state around housing, mental health, and education. So this monthly webinar, what we seek to do is bring on guest speakers who work in this capacity and talk firsthand about the practices in their community. And also, more importantly, or also as importantly, give you time to ask questions to these individuals. So after all this housekeeping is done, we will have about a 20-minute presentation time followed by a 15-minute question and answer time. And so for this month, we will be focusing on, collaboration and the unaccompanied youth aspect of that. For next month, we will be focusing back around housing. A couple of other pieces around Texas Homeless Network. We are a nonprofit, membership-based organization, and we provide solutions to ending homelessness to Texas communities through education, resources, and advocacy. Please check out our website at thn.org. A couple of other announcements. Trainings that we have had recently in the past. We finished up our Healthcare Plus Housing Summit here in Austin in March. And then last week we finished up our Case Management Institute that was started on, or that happened on May 20th and continued through the 21st. That was also here in Austin, Texas. We do have our biggest event, which is our yearly conference. It will be coming up on September 30th through October 2nd, and it will be happening in Corpus Christi, Texas. So please feel free to visit our website, learn more about all of these trainings as well as our yearly conference. With our yearly conference, we'll have approximately 400 to 500 individuals that attend that, and it'll be a great time learning about best practices with multiple tracks having to do with case management, youth, education, all different pieces. A couple of other training pieces that we have going on. Of course, we have our monthly Bloc talks. These are typically the last Tuesday at 2 p.m. We also have other webinars, either Bloc talks in the past that have been recorded, as well as other webinars that are currently going on. So feel free to get on our website, and you can sign up to be updated around all of these webinars. There is our information, our physical address, as well as our internet email address. And then you can also get onto our website and learn about becoming a member and the benefits of becoming a member organization at Texas Homeless Network. Got lots of cool things, discounts on our conference, really getting into many of these other webinars, other trainings for your staff, as well as other services and TA we can provide. So we're going to start off this month's webinar by offering a poll. And this poll is really to find out how many collaborations you're a part of. So I'm going to announce this. I'm going to put out this poll real quick. And so feel free to put in there how many collaborations you're typically a part of. Hold on one second. We're trying to figure this out.
Just put in the chat question. I'll have to toggle that closed.
All right. We're having a little bit of issue. So under your chat question, yeah, well, that didn't work out as we intended. Under your chat questions, could you put in whether you are a part of one collaboration, 2 or 5, or how many you are a part of?
2.
All right, we'll give you a couple more seconds. So it looks like many of you guys are a part of multiple collaborations, and this specifically is something that I thought would be true for most of you guys, and that's because working in the community and with multiple providers out there and really trying to maximize our resources, we are a part of all types of collaborations that are happening all the time. I know myself, I sit on 2 or 3 committees as well as multiple collaborations underneath each committee. So thank you guys for that feedback, and we'll try to fix the whole chat issue before we get to the next chat question. So for this month, we have Elizabeth Lutz out of San Antonio, Texas, and she serves as the Executive Director for the Health Collaborative. She's been with that organization since 2007, and she has served in multiple roles while she's been there. Her primary role has been to support and manage the organization's finance and operations while also providing administrative and management support for all the organization's programs and community initiatives. So in this capacity, Ms. Lutz works diligently to foster an atmosphere of continued growth and professional development for her staff, motivating and empowering the staff and others to embrace her role in the health of her community. So she asserts her passion for community health, equality and service, and collaborative vision to construct sustainable and resilient processes that will directly impact the health status of the community. She also works with the board of directors and the staff to provide the highest standards of collaboration, sharing of resources and best practices to increase the impact of services for the community that they are privileged to serve. So I know that many of you guys are working in many collaborations, and so it's my privilege to bring Elizabeth here today. And Elizabeth, I'm going to unmute you.
Just fine. Just give them the screen.
Can you say something for me, Elizabeth? I think we might have lost you. There should be a PIN number that was just sent to your to the tool, and you can use that to call in. Everybody just hold on for 1 second, and we're going to try to get Elizabeth back. We had her on earlier, I promise. All right, hang in there for just just 1 second, everyone, while we clear up this little technical issue.
Elizabeth, you there?
Can you hear me now?
There she is.
Yes, we can hear you now.
Okay.
Let me give you control of the screen.
Okay.
It is all yours.
Okay, thank you so much. Let me just make sure that I've got this set up properly. Okay, great. Well, thank you so much for that introduction, and I certainly do just want to say that we really appreciate you inviting us to be a part of the discussion here today. Just a little bit about the Health Collaborative. I just want to start off by saying that we have been very, very honored to have been asked by the National Association for the Education of Young Children and Ms. Patricia Julianelle, who contacted us back in 2013 to address a couple of different issues that have come up in our community with regards to unaccompanied youth and the issue of homelessness within our young population. When we were contacted in 2013, I will tell you that it had been a topic of conversation amongst many of the people that we were leading with regards to access to health care and supportive services for families. But when Patricia contacted us, she made mention that they were looking for someone who could really help understand the landscape of healthcare and be able to provide services or to provide some support with regards to the issue of healthcare for some of these teams. So when we first were approached, it was really more of a question of how can we become a collaborative partner with the San Antonio Unaccompanied Youth Task Force. But very quickly we realized that the Health Collaborative had many, many resources that were going to be readily available for the coalition to continue to do a lot of their planning work and, of course, their action work. So the presentation that I'm going to show you guys today really is about sort of our organization, which is the Health Collaborative, who is really a combination of quite a bit of stakeholders that are working together to address the needs in of our community through a county-wide needs assessment that we do every 3 years, followed up with a community health improvement plan. A lot of the work that we have been doing since '97 is really focused on social determinants of health and really looking at barriers and access to healthcare. But when we circled back and were able to learn more about these partners with their focus of unaccompanied youth and homeless youth, we really found that there was a lot to the data that we were collecting, and there was a lot of unanswered questions that we felt was very important for us to bring to light to many of the leadership here in San Antonio. So with that, we start, again, the Health Collaborative itself is a 501c3. We're a nonprofit agency. We began back in '97 informally through a group of 4 hospitals. And our primary goal was to come together to conduct a needs assessment. In many other communities, probably yours, you may be familiar, hospitals need to have a needs assessment done every 3 years in order to fulfill a federal requirement. They use this information to organize themselves and to provide a community benefits plan, which is also provided to the IRS for regulations and for some of their accreditation. So initially, the organization that we have now was done or was created with the intent of doing one report so that there was less confusion in the community about what the leading issues were. Fast forward to where we are now, and we have done over 6 assessments with the entire county and broadened the scope of the assessment, not just from a hospital perspective, but from a community-wide perspective. Our organization in itself is a unique collaborative model for addressing community health issues. We have multiple partners on our board of directors, but also have multiple coalitions and lead multiple coalitions in the community that also bring together diverse partners to work on this issue. The process that we take is data and surveillance. It is data driven. We do look at data indicators to see exactly what the issues are within our community, but we pair that with a lot of community voice and civic engagement to really understand what some of the barriers are within the community and help to understand what resources should be brought to the table by many of the different stakeholders that are involved. So our mission collectively is to improve the community health, the status of the community through collaborative means. Again, our purpose is really to start the community health assessment that would meet the needs of local hospital systems, but we've gone way beyond that at this point. We wanted to use that to illustrate a strong collaborative model for community health in San Antonio, and we are actually the first in the nation with a non-competitive model. So at the table, like I said, we started off with 4 hospitals. Now we have the 4 major hospitals here in San Antonio. We have the city and the county joining in forces. We have stakeholders from the different universities and multiple community-based organizations that are also coming together to really utilize each other's resources and understand each other's capacity in order to be able to provide more supportive services to the entire county. So fast forward here. Again, this is just a snapshot of who is currently on our board of directors. This is our top leadership, and then from there, we break down into multiple coalitions that work and address separate issues. This is a quick overview, again, of our history with doing these assessments within the county. Our first one started back in '98, and you'll see that we've continued through 2002, 2006, 2008, and our most recent one that was conducted was in 2013. But we are actually in the process now of conducting planning out the 2016 community needs assessment, which is heavily rooted with the key findings that we've had from the Unaccompanied Youth Task Force and looking at homelessness, specifically in children within our community. In 2010, we started a partnership with the health department to understand sort of their accrediting process, and they've been historically needing to conduct a community health improvement plan, which is more of an action plan of where stakeholders can really combine resources and look for strategies that will address the gaps in service. So while the Health Collaborative had been doing this annual report of identifying the gaps in service, the community health improvement really allowed us to be able to bring more stakeholders to the table to address the needs, but also, again, conduct a community-wide strategic plan to address those issues and how, again, we can share our resources together and create a bigger impact. The community health improvement plan allows us to also demonstrate where increases or where we are doing better in certain areas, or where maybe there is a lack of resource that we need to continue to work towards. So again, all of the work that the Health Collaborative does really is based on social determinant modeling, and we focus on what impacts our health. Some of you guys may be very familiar with this. This is from the county rankings, the Robert Wood Johnson Foundation. So this is just an overview of what we use in order to keep ourselves focused and where our resources are our place. This is something that, again, we try to emphasize on what has the largest impact versus what has the smallest impact. And there's all these different layers of how, from individuals to interpersonal to institutions to community and to systems, and how we all have a shared role in addressing the gaps and addressing the issues in our community. So for the Health Collaborative itself, one of the things that we are very keen on is understanding that the environment, our health behaviors, and socioeconomic factors have a lot to do with how either things progress or regress with regards to health. And so again, this goes back to where our priorities lie and where we're spending the majority of our focus in re-educating or advocating for services that are really needed in our community to address the barriers that families have. Currently, the priority issues for the Health Collaborative are all community-based activities that are centered around the priority issues defined by the Health Assessment and the Improvement Plan. And for now, the Health Collaborative is focused on the priorities of healthy eating, active living, health literacy, and health education for all families, access to care and community resources, behavioral and mental health, sexual health, which includes HIV, and teen pregnancy prevention, immunizations, and unaccompanied youth or teen homelessness specifically. One of the things that I could tell you with each of these is that they all cross. We use a grading system here at the organization where we like to look at how each of these different priority issues really cross over. So if we're working with unaccompanied youth, how can we lend the expertise of other community partners to be able to help address, let's say, the food issue in some of the coalitions? One of the things that we've learned with the unaccompanied youth is that we have many kids that are going from house to house or living in substandard conditions, and many of them have very little to no access to health care. How we bridge those partnerships with hospitals or clinics in the community to address those gaps, or how we provide resources to those families or those children for health care becomes a very real task when it comes to doing collaborative work. So for us, a lot of the questions that have been asked is, why does this matter to us? Why is the Health Collaborative leading this effort? Again, going back to the work that we do with regards to social determinant modeling, looking at different root areas for health improvement, we have to ask ourselves, so what are the leading causes for homelessness in our youth? And primarily we see that family dysfunction is a leading area of conflict with step-parents, conflict over youth sexual orientation. This is a huge barrier here for some of our youth. We've started to develop some key partnerships with grassroots organizers to identify opportunities for safe places for LGBTQ youth. There's also conflict over youth pregnancy. This is why we're very active with the teen pregnancy prevention and education program in the school district. With family violence, we are partners with many different educators out in the field that can help provide services or shelter services for unaccompanied youth that may have been sexually abused. Again, there's these other indicators of loss of parents, incarceration, juvenile justice is also part of the coalition to help and understand those different areas. So the unaccompanied youth here in San Antonio is completely volunteer-led. The Health Collaborative, what we do is that we provide the governing body, or we provide the financial support in order for the unaccompanied youth task force members to really focus on these 4 areas that they selected when they first started. And these were areas that they had selected even before the Health Collaborative became the lead agency or the parent agency for this subgroup. The 4 areas that they're focused on is definitely on food. They've created some plans with regards to identifying a local space for food delivery or food drop-offs for youth where they can actually have a safe place to be able to get some food that they can travel with. Juvenile justice is another subsector of the unaccompanied youth task force, which really is focused on looking at the issue of truancy and how schools or even the courts handle unaccompanied youth that have been identified as truant. There's also a subgroup here focusing on the housing issue, and we have great partners with the Housing Authority of Bexar County that have really helped understand or helped us understand the landscape of what that looks like. And then, of course, the Health Collaborative has been a key instrument behind bringing all of our partner resources together to address the issues of access to healthcare and health. So the Health Collaborative, again, because we are involved with so many other coalitions, we've been able to bring in key partners and support for the unaccompanied youth to the other collaboratives that we lead. Our Immunizations Collaborative currently supports and provides resources for coordinated access to immunizations. In listening to some of the barriers to families, it was really sometimes that the children are identified because they have not been able to go to school, they didn't have their immunizations. Even though they're in a McKinney-Vento program where it offers them some level of protection, the true need for access to health care is something that continues to be needed. And so our Immunizations Collaborative has been instrumental in being able to identify what are some of the gaps or some of the policies that we have in place right now that really increase the barrier for some of these kids to be able to continue to go to school. So we've partnered with a couple of hospitals and a couple of clinics to be able to do stipend reimbursement for immunizations or referrals for immunizations for some of these. Our Youth Mental Health Council is another sub-council, and they provide guidance and leadership in addressing gaps in service for youth mental health. So right now we're working on a referral program where we can identify youth that are going through different issues, and we'll be able to give them some counseling through one of our partner agencies like Raise the Freedom, or we can provide some of that stipend reimbursement to any of the shelters that currently provide services for the unaccompanied youth, either as a drop-in center or as a risk. And of course, our Healthy Eating Active Living Council are giving us some information and some access to foods and food drop services, food pantries, and food vouchers for some of the kits that can be used. So the way the Health Collaborative has been able to leverage partnerships is these are just a few of the partners that we've been working with very closely to take a look at not just the policies that are currently in the county or currently in the city that again are giving or providing more barriers to these children to access resources, but also look for ways that we can leverage each other's resources to be able to provide some supportive means for these identified families. We do work, and we have been working more closely with some of the family liaisons and having one-on-one meetings. One of the things that we found with the San Antonio Unaccompanied Youth Task Force is that there is a very big division between what is AHUD definition and what is the federal definition for, the Department of Education definition for unaccompanied youth. The Health Collaborative's role is not to take sides of choosing one definition over another definition, but really to understand that the true mark is where kids are being, where a lot of the kids are being left behind, and gathering the partner resources to be able to address those gaps, regardless of what definition we're using, but really focusing on what the true need is for that family member or for that child. One of the things we've also been able to do is raise awareness of the issue within other stakeholders that maybe otherwise would not have really understood what their role may have been or how their resources can be shared to support these families. So right now, a lot of the things that we're doing is gathering and restructuring the San Antonio Youth Task Force partner group and really focus on making sure that we're engaging as many stakeholders that can come to the table to learn more about the issue of homelessness and youth, and to learn more about how that affects not just the same institutions that offer the services, but really as a community, how we can come together to provide more support, whether that be legislatively, whether that be advocacy, whether that be grassroots organizing, or whether that be changing local policy or clinic policy in order to be able to address those services that the families need. So right now, one of the things that we're encouraging also is to get connected to more stakeholders like you to learn about some of the practices that you have in order for us to be able to fully support our coalition here locally. Right now, again, we are doing things a little bit different. Before, we used to meet every other month, primarily with family liaisons and school district personnel. And we started to change that a little bit to do more one-on-one meetings, focusing on doing actual site visits with charter schools or family liaisons at the school district that couldn't otherwise come to the meetings and be a part of that collection, the collective impact. We've also started to take a quick survey of the different partner groups to address any areas or any resources that they might need. One of the things that we've been able to do is provide an online information or support list for our liaisons and be able to distribute that wide. These are kind of like wallet-sized cards that can be passed out to youth and have quick information or quick links to phone numbers that they can access. It is an online directory as well, so many of the partners have really liked that it's something that they can have readily available for themselves. And those are just beginning things that we're doing for the liaisons to try to build some support around them. But right now, again, we're really focused on redeveloping a coalition and encouraging more partners at the table, but having this one-on-one conversations to address the true needs that they have as they're working with many of the youth and the families that have. So that's pretty much a quick overview of the coalition here in San Antonio. And if I can answer any questions that anybody would have. I know it's quick, but
Yeah. Can you hear me?
yes.
All right. We have a couple of questions. Before we get into the questions, though, I want to remind everybody to post your questions now on the toolbar on the right-hand side. And then I have a quick poll I'm going to put up. So I'm going to send out that poll right now. Make sure see if it works this time. Well, we're having some issues with our poll stuff. Let me see if I can redo that one.
You can't open them back up.
Well, never mind. I'm not going to do the second poll either. We're having some technical issues with that, and so we'll just go ahead and jump right to the questions. And so our first question. Hold on one second. Let me switch over. One second. All right, so here's our first question from the Houston area. Elizabeth, are you guys organizing resources differently for youth under 18 than those that are 18 to 24? And do you notice differentials in the local data between these two subgroups?
So yes, we are organizing resources differently, and that's again the reason why we've decided to do some individual partner interactions. One of the things that we're doing is in collecting the resource guide that we did, we're actually going to now subdivide that into all partners that are able to serve children under the age of 18 and those that are over, and then provide a different type of resource there. Definitely the data will show us where we have gaps, and again that goes back to understanding what even some of the individual policies at clinics are. We found that there are some clinics that will not provide any kind of services to teens, even though according to some state legislation they are able to provide services. It's more of an internal policy that we need to work with the partners to change and sort of re-educate, but we are definitely going to be aligning the resources separately.
Great. Thank you so much for that feedback. That's awesome. Okay, the second question I have is what are some steps that THC took to build cooperation among collaborative members?
So I can tell you that when we first started, there was a big piece of us where we really just came in offering everything that we had within our toolkit. So a lot of this was these were partners that we had already worked with at some point or another, whether through a different project. For the school district, we had many opportunities to collaborate with our fitness program or our training and education program. So within an institution, one of the things that, of course, we know very well is that you can work with a school district. There might be 15 different people that you've worked with, and sometimes it just means that you reorient yourself to that partner for that specific need. What we ended up having to do is really organize ourselves in such a way that it was like reintroducing ourselves and reintroducing our whole organization to the partner. And again, this is why we've decided to do a lot of the key surveying, is to understand exactly where they are. In San Antonio, we have 16 separate school districts, all with different policies. And even though the majority of them know McKinney-Vento, we also found that it was a very isolated piece of the structure of the school district, where maybe the entry person at registration didn't have all the information about the McKinney-Vento Act, and so there was re-education that needed to happen there, or linking up with partners and understanding that they had a place to call versus before where they were just given a number but no one would answer. We had to become very, very specific in addressing the call and addressing the need for that specific individual to encourage participation, and then also to encourage trust.
Great, great. All right, any other questions around just collaboration in a community, and also the unaccompanied youth aspect of this collaboration and this work? All right, we have another question. I work with former foster youth that have aged out of foster care. The big problem is that our youth must go through 211 to get transitional Medicaid. Also, the mental health providers are few and far between in my area. Youth must give up their health coverage if they want North Star. So it sounds like the question might be, are you guys working on doing something else besides 201 to work with youth that are aging out of foster care? Like another referral source?
Right. So we've developed a different toolkit just for those for families. And it's not to take away from the 211 service. I think we definitely still have value in that. But for those families and this specific group that is looking for something much more targeted, this is why we've developed an info card specifically for that target population. And then we also have our community health bridge, which also offers a different layer of support to electronic-based, and it is an app that can be downloaded. They can specifically do search options to be able to do that. Now, as far as mental health services or things like that, those are the things that we're aligning partnerships for. So there's specialized programming to be able to refer a child in to the program itself and be able to offer some kind of counseling. Sometimes it's just a matter of providing an open space or a safe space for the kids to be able to come and drop in and be able to access the resources that they need in order to build trust even with that population. So we're looking at different types of strategies right now, but I think one of the biggest things is that we've had great support from different partners to think outside the box and look at things that have been done traditionally in a way that speaks more to the population that we're trying to attract.
That's great. I know, especially with this population, it's really difficult, and you have to think outside the box because typically the way, especially youth that are aging out of foster care, socialize and communicate with one another is very different than the way that our agencies do that, and the way that our typical clients do that. Awesome. Another question is, can you clarify what housing for these teens look like? So just a little bit of clarification around your housing options in San Antonio.
So, and that is something that the subgroup under the housing piece for the San Antonio Task Force is working on. Again, we've been primarily working with the Housing Authority of Bexar County and understanding exactly what is available to our youth. Right now, we don't have transitional housing for youth, so that's an area that we have been working on, and we've been strategizing around, making some proposals or making some recommendations on how we can change that. But primarily right now in the city of San Antonio, we have limited to none limited transitional housing for the youth that are coming out. Many of them that we have been able to identify and help have been situations where they are either young parents or about to be young parents, and so they go through the process of the housing application. And we've had some success cases there. But we work with multiple partners here to try to get them connected to the services that they can and go through the housing process that currently exists. But at all times highlight the need that we need some additional resources or some transitional housing resources for our unaccompanied youth.
Great. It's great that you guys are recognizing that and see that, because I know that is that's a big issue just across the state, is that transitional housing. Another question around the healthcare passport for foster youth. Do you guys have a healthcare passport for foster youth, and what is the status of that?
We don't have a healthcare passport right now. Again, those are, a lot of the conversations that we're having is how we can create that as a community. And so right now, the role that the Health Collaborative has been able to play is to start looking at all of these different opportunities. But we have not had, we don't have anything published yet.
Good. Well, thanks. Yeah, I know that also can be a piece that's difficult to get going and get off the ground, and just making sure that is involving the healthcare piece, make sure that it's shared amongst the whole community can take a little while to get going. Any other questions for our audience, or is from our audience? You guys have asked some great questions today. Oh wait, we got another one. Let's see. Are you aware of the Section 811 project-based rental assistance program for youth with disabilities aging out of the foster care system? Is that a program that you're aware of, Elizabeth?
No, I don't have information on that right now. Again, that would be something that our subcommittee under housing is working on, but I don't have information on it offhand.
Great. Well, that's great that you asked that question. So Elizabeth doesn't have that information, but what we can do is I will get you the information, maybe get you connected to the person that's asked the question. Maybe they have some information, or maybe THN can actually gather some information as well.
Perfect.
Okay, so a couple more questions are rolling in. Can you share the info about the alternative to 211 for foster youth?
Yeah, I can actually forward the info card that we have. I don't know if I send that over to you, Chris, and you can sort it out, or I can send the link to the electronic version.
Wonderful. Definitely send it to me, and I will get this out to everybody on the call. Okay, great. I think that last question was just sharing some information around the project-based rental assistance, the 811 piece, so I'll get that out as well. So wonderful. You guys are using our webinar about collaboration to actually collaborate and share information, so that's wonderful. That's great. So yeah, I wanted to, well, first of all, if you have any other questions, feel free to post them right now. Elizabeth, I just want to thank you so much for being on the call with us today and sharing the information.
Good. Thank you so much for having us.
No problem. And what we are going to do is, of course, we have recorded this webinar, and we have, let's see, I don't think I have any other announcements for this one. So basically, I just want to say, next month, we will be focusing around looking at housing again around Texas. We will pick an agency or a community to focus on around housing, and I'll make sure I get get that information and then invite out to you, as well as any of the follow-up information on this webinar in an email probably within the next week. So all that information will go out. And then I will make sure that I get all this information that has been coming in through the questions as well, and so we can share that. So Elizabeth, I just want to thank you again for being on the call today and sharing information about collaboration and the unaccompanied youth aspect. And we will be posting this, and I will be making sure that everybody that's on this call gets a follow-up email about all the contacts and the shared information. So thank you guys very much, and we will see you again next month for our June Bloc Talk. That'll be the last Tuesday of June. Thank you, and I am signing off.
Thank you.